Michał Posławski, the commercial director of the rehabilitation equipment manufacturer Tech Metropole, is proud to present its range of production, technical capabilities of equipment, and the movie titled Physical Rehabilitation. The basic equipment in kinesiotherapy is an exercise cage with a rehabilitation table and accessories for exercises and suspensions in the form of ropes, slings and weights. This set is the Universal Exercise Unit UGUL WSC4 type. Physiotherapy is a part of physical medicine, which includes physical therapy, treatment using physical factors like heat, cold, healing light. Balneotherapy, which uses the therapeutic action of mineral waters, pellets, gases contained in some of the spas. Dry massage uses a variety of techniques for therapeutic purposes. Kinesiotherapy, a treatment based on movement. The goal of rehabilitation is to restore lost motor functions as soon as possible. Suspending patients' limbs in the UGUL cage on ropes and slings apparently reduces their weight and thus facilitates performance of a number of therapeutic exercises. It allows to enlarge the scope of joint mobility with overcoming mobility limitations caused, for instance, by pain. In the self-assisted exercise of shoulder girdle, the main objective is to increase the mobility of shoulder joints, increase of muscle strength, and motor coordination. In the cage, the healthy upper limb is supporting movement of the disabled limb. The KCO3 rope is willingly used to exercise with women who underwent mastectomy. Resistance exercises of the shoulder girdle and upper limbs with the use of KCO4 rope can be performed in lying, sitting or standing position. In patients with paralysis of one limb, the grab gloves are used to secure the holder. In the shoulder rotor, the resistance mechanism can be adjusted to operate in accordance with the anatomical axis of the shoulder joint. A patient is performing arm flexion and extension with dose resistance, as well as abduction and adduction of the arm. The RB1 shoulder rotor, due to long arm, must be mounted on the wall or on the outer side of the UGUL cage. Then, exercising patients will not jeopardize other participants. In lying in side position, the hung left lower limb performs exercises with dose resistance of flexion and extension of hip joint, increasing strength of gluteal muscle. On the seat beside there are performed resistance exercises of lower limbs. Slings and ropes allow free hanging of patient's body parts. In the position, the patient is exercising to expand the scope of motion in the hip joints. A simple way to reduce lumbar pain is the use of the pelvis intermediate traction. Pelvis and lower limbs of a patient are installed in slings with a KC13 traction belt for a pelvis and extraction of the KCO5 rope with load. Dosed load for 30 minutes stretching of lumbar spine starts from 1/7 of body weight. A series of traction amounts to 15 repetitions. After traction, a patient should remain in the same unburdened position for the same time as the traction lasted. The traction should not be applied in acute states. Advantageous relaxant and analgesic effects for spine are obtained in partial and total suspensions. Preparations for total suspension are taking place on the table. Exercises in total suspension bring full relax of tense muscles, preparing a patient for proper kinesiotherapy. The treatment of cervical spine traction as an intermediate lift of head with a glisten sling is generally performed in a seated position, with a sling mounted on an independent arm of the wall, in the calmest place of a room. This traction can be also used on a table, in a back-lying position. Preparation for such traction is being done in the UG well cage on the table. Cervical spine traction should be preceded by heat treatment, for example Solix or dry massage. The procedure takes 30 minutes and the series up to 15 repetitions. The load is 2.5 to 3.6 kg. After each traction, a neck brace should be put in and a patient left alone for the same time as the traction lasted. The same sling can be used in many ways, in assisted exercises, active, free and resistance ones. The purpose of rotors is to increase limb joint scope of motion, muscle strengthening and recovery of motor coordination. There is a whole family of rotors for resistance exercises of upper limbs, for supination and pronation of lower limbs. They are small devices, therefore can be used in rehabilitation clinics, hospitals, nursing homes, and even at home and at a patient's bedside.